June 20th rally in Tulsa, that number had reached 115,000 Americans. And by December 2021, over 800,000 Americans had died of COVID-19-related illnesses. But you wouldn't know the country was in the throes of a public health emergency by looking at pictures from June 20th. Almost everyone in the arena was unmasked, and there was no social distancing. Public health officials and experts had warned the campaign against holding an indoor rally as COVID cases continued to climb in Oklahoma. But here were more than 6,000 Trump supporters coming out to see their president. It wasn't a full house. The arena was only a third full. But Trump was back on the road as if the pandemic was over. During his remarks, he even quipped that unlike him, his Democratic opponent, former Vice President Joe Biden, remains silent in his basement. Biden was like millions of Americans, still at home, still socially distancing, still working online, and still navigating the real uncertainty of life during a pandemic. Trump's Tulsa rally was a spectacle designed to project strength and business as usual, confidently flouting public health recommendations and the common-sense precautions adopted by hundreds of millions of Americans during the pandemic. Biden eventually resumed campaigning, but only in socially distanced parking lot events, while Trump kept up his in-person rallies, oftentimes held indoors. Republicans even tried to hold a traditional in-person national convention in Charlotte, North Carolina, but were forced to scale back to a hybrid format when the state government refused to allow the event to proceed at full capacity and without face masks. Tulsa, and over a dozen similar campaign events held after, would come to be described as super-spreader events. 8 Trump campaign staffers tested positive for COVID after the rally, and Tulsa health officials noted the rally likely contributed to a surge in new COVID cases. One study estimated the collateral effect of these Trump superspreader events. Nearly 30,000 confirmed COVID-19 cases, likely leading to more than 700 deaths. Trump himself even became a vector. According to White House Chief of Staff Mark Meadows, Trump tested positive for COVID-19 on September 26, 2020. He then kept up an active campaign schedule for almost a week, knowingly exposing more than 500 people, from fundraisers to staff to Gold Star families to Democratic candidate Biden at the presidential debate in Cleveland, Ohio, before being hospitalized at Walter Reed National Medical Center on October 2nd. Trump received cutting-edge experimental treatment and walked out of the hospital 3 days later. Upon returning to the White House, he was photographed immediately removing his mask with a still active case of COVID-19 in the presence of White House staff. He tweeted, "Don't be afraid of COVID. Don't let it dominate your life. I feel better than I did 20 years ago." The same could not be said for the more than 210,000 Americans who had died by that point. Politicizing a pandemic. It is difficult to describe the devastation that the COVID-19 pandemic has wrought in the United States. Rich and poor, red states and blue states, black and white, coastal and inland, metropolitan and rural, no corner of America was unaffected. The first known deaths occurred in mid-February in Santa Clara County, California. In March 2020 alone, more Americans died from COVID-19 than the number killed in the September 11th terrorist attacks. By the end of April, the death toll surpassed the number of U.S. military personnel who died during the Vietnam War. By December 2020, at around 3,000 deaths per day, each day was a 9/11. By June 2021, when just over half of Americans had received at least their first dose of a COVID-19 vaccine, the total number of deaths